Okay, shifting gears again, we're going to talk about trauma counseling. And the coordinator of that is Dr. White, and she's going to come up and share with you a little bit about that.
I'm excited to get to talk to you about the trauma track. A lot of you are in my class, so you know that I love the trauma track. But it's a privilege to get to talk to you about it because I really believe in it quite strongly. Been here. I think the trauma track is about 8 years old, and I've been here since before we even formed it. A group of our faculty went up to Boston about that long ago, maybe 9 years ago, and met with a team in Boston at the Justice Resource Institute in Boston, which is an institute led by a man named Bessel van der Kolk. And you just saw some famous people here on the working in the sex and the Christian sex therapy certificate program. But Bessel van der Kolk is a huge name in trauma. He's huge internationally and nationally in the area of trauma, and his team has they helped us create the trauma track. They trained our faculty, and they are either still coming down themselves, or the people that they have trained are the people that are coming here to teach the courses in the trauma certificate. Some of you have had some of those classes. I see an Aaron here, and can say that they're really some quality people. So. To me, that's one of the strengths of the trauma specialization is the nationally renowned people that we have coming to teach this in this course. They're also teamed up with Richmont faculty as well. So Dr. Bradshaw himself has taught in some of the trauma classes, and Dr. Presley, who used to be faculty here, is teaching some of the classes. So we have some teamwork between our faculty and these nationally renowned faculty that are coming in. Another strength of the trauma certificate is that I think that the trauma certificate, if it's something that you're drawn to, it's very applicable. Unless many of the clients that you will see in your career will have had trauma. We think Dr. Snyder, I believe, that on the sex therapy track, also does a lot of work with trauma, and she was thinking that about half the people that come through the Hope Centers have trauma, and that's probably the case here as well. Almost half of our clients probably have had trauma. It could even be more, depending on sort of exactly how you define trauma. But it's very, very applicable. There's things that you begin to understand in these courses that you can see resonating through your client base all around. Also, there's a course in the trauma certificate for children, and there's a course for adult treatment as well. So if you're interested in kids, but you're also interested in trauma, the cool thing about the trauma certificate is that you can experience both. You can have the first class in the trauma track is called Trauma in the Developmental Context. And that course it's a course that talks about when you have trauma, what happens. When you have an early trauma for a child, what transpires, what occurs in the rest, how does that trauma permeate their life, I guess is what I'm trying to say. So, for example, if you have a child who is living in a house maybe where there's a lot of drug use and there's drug deals going on and there's not a lot of money and there's danger and maybe there's people that get shot in their building and there's very scary things that happen to them, you can imagine that child might have to be very vigilant and be very watchful and be afraid and be wondering what might be going to happen. And so you put that child in school, and here he is in school, and maybe he is sitting there, and some teacher is up here going on and on about blah, 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 numbers or whatever, and handing pieces of paper around. But there's other things going on in the room. People are moving around, or people are passing notes, or people are, he's going to be watching all of these things and wondering, am I safe? What's happening? What's going on? So, okay, he's very vigilant. He's vigilant for lots of things going on in his classroom. Maybe he's not attuning to the learning, so then he doesn't learn his math tables. And so then people make fun of him, and they don't really ask him to come because he can't answer what the teacher says. And so then he doesn't have friends, and so he doesn't really have people to comfort him when he gets in trouble, and he doesn't know who to go to. So this thing starts cascading out into his life and keep resonating through his life. Just those few things, much less the over and over again, the kinds of rejections or hurts that a person can experience in their life. So that's just a teeny example of how trauma keeps on going. And we're going to talk a little bit about the types of symptoms that you can see in a person having difficulty regulating their emotions. A child like that who's maybe had to be in danger or whatever can be very alert to an expression on a face and could instantly be very, very angry or scared or upset, when another child who hasn't had all those experiences might not be quite so upset by the same facial expression. So there's a lot to do with emotional regulation that goes on in trauma situations. But anyways, all these things kind of come together in terms of when you're seeing clients, to be able to see them with a trauma lens, to be able to look at people, and maybe you see a behavior of a person who's acting out or who's very angry, who's very volatile in their emotions. And maybe we might want to naturally just withdraw from them or be frightened of them or not quite know how to approach them. But if we can think about them perhaps through a trauma lens, maybe we have a different kind of compassion, or maybe we have a different understanding, or maybe have a different way to approach them. And so that's kind of the heart of the trauma track. I'm just going to go through this really quickly, but when you have a person who has experienced trauma, they can be in any one of these states. You certainly would hear a lot about a person being a victim or maybe a survivor. Sometimes people don't even quite feel like a victim. They're just, they don't even feel whole as a person. They don't feel solid in their self because they haven't really had enough attachment, that the attachment in their life has been so poor or so limited that it's hard for them to feel that they've formed as a self. Some people have some sense of self but feel damaged, feel like I'm not okay, I'm not good enough, but they don't necessarily identify as a victim. Some people, as I said, a victim. Some people maybe as they're survivors, like identifying themselves as having conquered their trauma, maybe after going through therapy for a while or something like that. But one of the goals that we talked about with Dr. Spinazzola, the coordinator of the trauma track, is actually bringing a person all the way to just feeling like a person, so that they feel whole enough that their life is not defined by their trauma anymore. That their life, that they are whole, that they feel I'm a person, not just a survivor of trauma, but I am a person. I'm a whole person, and so I can relate and re-engage in the world in that whole sense. These are 4 parts of the adult trauma model that Dr. Spinazzola, the coordinator of the trauma track, teaches in the trauma classes. And these 4 aspects sort of blend together. Kind of go back and forth. Certainly helping a person to experience a solid relationship, working through attachment issues that are often very, very broken in a trauma situation. I mentioned about regulation, helping a person to be able to regulate their emotions, helping a person to be able to understand when they become triggered and super upset about something, how to calm themselves down, how to manage their anxiety, how to manage their depression, what to do with that. Also helping a person to understand sort of the brokenness inside of them, how they may have different parts of themselves. Sometimes we have, sometimes a person who's experienced trauma, you can see this more clearly, but I think we all have different parts of ourselves. We have the parts of ourselves that, can go up and do a talk. And then the other part of yourselves that can be, kind of lounging around at home and, making a mess or something like that. I don't know. But a person with trauma may have a part of themselves that has very much difficulty trusting. And so can be in situations where that part of themselves gets very activated and they feel very fragile and they feel a lot of difficulty with that. Then they may have another part of themselves that's a strength that loves working with children, that feels nurtured with, that feels a kindred with them and feels drawn out by that. And so sort of helping a person to see the different parts of themselves and accept them all. That's parts work. Helping a person to see the different facets of myself and be able to welcome and accept all of them and see how they integrate, see how they play off of each other, how to give them all space. Those are all parts of who I am. Narrative is helping a person to understand their trauma story, to be able to tell their trauma story without being so triggered that they have to run away from it. So that's part of the process of trauma work. So doing these different things, working on that relationship, helping a person to feel all their parts welcomed into that relationship, helping them to regulate their affect, and helping them to be able to tell their story. All of those 4 things are kind of going on. Dr. Spinozzola has a double helix. That's why I'm doing this with my hands. He has a double helix that's like a DNA molecule, and so it goes like this. And so you're like doing these things all at the same time. So that's those things are blending together. In the child trauma treatment, there's another model that is just a little bit is very similar. Talks about attachment that we just talked about. Talks about regulation, so emotional regulation, and for children talks about the area of competency, helping a child to feel like I'm good enough, or I'm good at something, or I can do this, or I can manage, which is often very broken in a child that has a trauma history. To just feel like I'm okay and I know how to do this, or I can read, or I can play this game, or I can get along with people. So helping them to feel a sense of competency inside themselves. So those are goals and sort of areas that we encourage when we're doing working on the trauma model with children and adolescents. One of the first books that we read in the trauma track is by a woman by the name of Judith Herman, who talks about the effects of trauma in a person. She made some definitions of how trauma affects a person, and these 6 areas are some of the main areas where we define the effects of trauma in a person. I've mentioned several of them already: the alteration of affect, or difficulty regulating affect or feelings and impulses. Mentioned difficulty regulating attention and concentration for the child. Difficulty in not feeling okay, not self-perception. I'm not good enough, I'm damaged goods, I'm not acceptable, I'm not okay. Difficulty in relationships with others, not trusting, not feeling safe, not feeling like I can do relationships, like I know how to do that. Somatization we didn't really talk about. That's kind of a word talking about how I relate to my body and whether I'm getting emotional symptoms expressed through my body in physical ways. So that's another way that trauma can be noted or experienced. And the last one is one that we, especially being an integration program, is important to talk about: alterations in systems of meaning, which can mean the whys underneath trauma. The systems of meaning might mean, who is my what's meaning in life to me? Who is my anchor? What does this mean? And so, where was God when this trauma happened to me? Why me? How come I was? How did this get to happen to me? So, when a person experiences trauma, usually if they had a system of meaning already, it can really be pretty much trashed. Like, why did God let this happen? How could this be? Where was God? Why did he not help me? All those kinds of questions can be there for a person. And so that's another part of trauma work, is being able to address that, being able to make space for that, being able to sit with a person with those kinds of questions and not always have the answers, but just be able to be with them and give them space to find new answers for themselves, to find meaning out of the pain, and meaning out of the relationships, and meaning out of the journey that God takes them through. I want to tell you a little bit of a story about a trauma client that I have, which this isn't a story from a book. So I want to be careful in how I tell it, because I don't want to tell too much detail about this person, whom of course I have permission to tell this, but still I want to be mindful. So I might stumble over my words just a little bit here. This is a person I've seen for a number of years. She has a very sad trauma history of abuse in her home by a stepfather. And it was ongoing, and a lot of rejection in her home by both parents. Abuse that happened over and over again in a lot of different situations. And when she finally got the courage to tell her teacher about what was going on, DCS came immediately. She was taken from her home, and basically she never returned. They had some sort of investigations about it. I think the investigators believed her, but the court system didn't. And basically, her siblings went back, and she was sort of shipped off, basically, and shipped off to foster care. And then once she became 18, somebody just drove her to another city and dropped her off. When I first saw her, I guess she was in her late 30s or maybe around 40. She came into my office, and she'd had some therapy before, several different therapy situations, but usually in an agency situation, so there wasn't like there was a relationship that formed, but then it would kind of get cut off because somebody would get transferred or moved or something like that. So she came to my office with a friend. Praise God for this friend who brought her to come in, and she just paced. She walked for at least 30 of the minutes, the first 30 minutes in the office before she ever sat down. Just that much energy, and that was how she was regulating herself. That just to be able to walk back and forth in the office. She wasn't angry that day at all, but as I got to know her, there was significant anger that she could have and really be really strong at. But most of the time, she was like uber compliant, like very quiet, very agreeable, very, quiet, but compliant. Like, no, don't make any waves, don't rock the boat in any way, shape, or form. You can imagine the rejection that she already felt. She doesn't want to feel that in a therapy situation. Attention concentration. I'm going through those 6 things is what I'm doing here with this client. And so attention concentration, she had lots of difficulty just explaining herself, just like finding words to talk about her feelings. It was hard. She would just kind of freeze up and not really be able to connect her words with what was going on inside of her. So she would, be feeling something but couldn't put words on it for me. So we would struggle through with that. Self-perception, the word that I would use to describe her was just invisible. That's how she dressed. Dressed is to be sort of as non-noticeable as possible. So she felt invisible, and that's how she felt like she had been treated, and that's what she expected from me. She expected in the relationship with me that I was going to leave. After I had seen her for quite a long time, she was still expecting that I was going to leave, that somehow she wasn't going to be good enough and that I was going to leave, which is, of course, what happened with her family, and she wasn't good enough. And so that's what she expected from me, that I was not going to think that she was good enough. Somatization, she worked at a very physically challenging job and kind of stretched herself to the point where she would be injured, but she would just keep going. She didn't really have a whole lot of good sense about taking care of her body or giving herself a break, baby, I guess you would say. Sense of meaning. She didn't feel that there was going to be justice coming to her in the world, as you can imagine from what her story was. However, she did have, and still does, have a hope in God somehow, because in that story, church was, some people took her to church on a church bus, churches that have done that. And she would go to church, and that was where she was safe. And she was a church that was safe. And so that a part of her story was still nonetheless through this, that there was a hope in God for her. So she and I worked together in that sort of model that I was talking about with Dr. Spinazzola, working very hard on this relationship, building trust. Like when I would forget to answer a question that she had asked me the next week, or somehow forget her in some way, it would be a problem because she would feel, rejected, and I would have to correct these things. And so pay a lot of attention to this relationship with her to make it solid, make it sure that she knew that I was committed to her, that I wasn't rejecting her. So I had to work on that really hard. How to help her to understand parts of herself. She has a great skill with kids, be able to encourage that, validate that in her, as well as the parts of her that like to be invisible or that don't like to be invisible. So understanding of the different parts that she has of herself. She's got a much more, as we've done those things, working on the relationship, helping to see the parts inside of her, helping her to tell her story, me listening to her story and believing her story, validating that it was awful. Those things have been healing things for her over time, and just the steadiness of the relationship, so that she's got a much better ability to regulate her feelings now. She can still get angry, but she can regulate herself back down more easily. She's more able to articulate her feelings. She's more able to articulate things about the relationship that are frustrating to her, or that she doesn't like. That's really big, because that was hard for her to have happen. She's able to see strengths in herself. She's able to feel secure. She doesn't think I'm leaving anymore. It took a long time, but she doesn't think that I'm leaving anymore. She may feel unusual things in the relationship that she doesn't like, but she doesn't think that I'm leaving anymore. Over time, that's been able to be changed. She has taken some steps to take care of herself better, and overall, she's got more safety in her relationship with God. So it's a privilege to walk with a person through their trauma. It's hard work and takes a lot of time and energy and effort, but the trauma clients that I've seen are probably the hardest clients that I've seen, but the most rewarding clients that I've seen. If God calls you, it's hard work, but it's very rewarding, and the trauma certificate courses, I think, will really help you to be prepared for those.